So this is Dr. Moga. I'm here to talk about residency and implicit bias, racism, and gaslighting. Yes, it happens way too often. So this is how it usually presents itself. Minority students find that their mistakes are often amplified. It could be in rounds, and if they made a wrong diagnosis, for example, the chief resident or attending will bear down on them in front of a team. And if you should know about residency rounds, medical rounds, it usually involves a group of almost up to 10 people. Everyone on that team, assuming let's say you're on the surgical rotation, general surgery rotation, you will have on that team a chief resident, 2 junior residents, an intern, maybe 3 or 4 medical students. You may have a pharmacist around with you. You may have a nurse around with you. You may have a social worker for disposition around with you. So it's a large team, and you go from room to room. You stand in front of the patient's room, look at the diagnoses, and whoever has that patient, which could be the medical student, would present the patient, or the resident assigned to the patient will also present the patient, and they'll come up with a diagnosis and a plan for the day, and then they might all enter the patient's room. However, only one person, the senior member of the team, during that particular time period will talk to the patient. So during those rounds, this is where you see hierarchy, and this is where you'll see those rounds are traumatic to a lot of us, because for some of us whose voices have been silenced for so long, you're afraid to say something in fear of being wrong and being ridiculed. However, if you don't say anything, you're assumed to be devoid of knowledge. You're assumed to be stupid. Okay? And depending on who speaks, because you can just be completely, if you get a malignant chief resident or attending, they can just tear you down to pieces and make you cry, humiliate you in front of your colleagues. So Black minority students find that a lot of times during such rounds, their mistakes are amplified. It's brought up to the team. How could you do that? Why did you do that? Who would do such a thing? And it knocks off your confidence. I'm not saying that you need to be patting people on the back when they're wrong. But what tends to happen is that you'll find that your other colleagues, their same mistakes are not ridiculed in front of the group. Their same errors are not talked about. And they get away with a lot more. So as this happens more often, you start doubting yourself. Am I good enough? Do I belong here? I should have known better. More on